Hey guys, Don Keating here, Team DonnyBoy8. Just wanted to do a quick update video on Synthium Health. It's one that we've been following here for a bit, and they are in their token sale. They are currently still offering a 25% bonus on SHP tokens, is the name of their token. But if you want to see the background of this company, definitely watch the prior videos that we've done. It went through more of what exactly it is and whatnot, but I wanted to go through a few different things today. This is their main website that's still going on. The token sale started back in November 27th and it ends pretty soon here. 10 more days on February 28th, 11 p.m. Eastern Standard Time. Okay, I don't have an update on how many they have sold so far. They don't have a running tracker or anything on their site, but they had a target of 100 million SHPs to be sold, and they had a hard cap of 200 million to be sold. They're selling them currently at 65 cents each, plus you're getting the bonus of 25% still. So it's definitely going pretty well. I checked in with the CEO today just to see how everything was going, and I went over some new information I wanted to go over with you guys on this video. But first off, there's an article written by Sean Gordon here on Medium, and I wanted to show you some of that information. I do suggest that you go here and read it yourself. I'll put the link in this below, or you can follow it right here on Synthium Health's Twitter account. There's the link right here as well. But it gives a background of what's going on with Synthium. Small to medium-sized manufacturers of medical devices cannot afford to employ large sales teams to go out face-to-face and hard sell products. They end up white labeling them to larger manufacturers that have the sales team, adding a couple extra layers into the mix that increases prices. Combine that with complex ordering systems, insurance reimbursement, rebate procedures, and so on. So this is one of the problems that Synthium Health is going to solve. And there's a survey here that was done, and you can see here management is this darkest color, and the next darkest color, inventory and order management, is a large portion of what these guys have as listed as their major expense. Millions of products moving through the supply chain every day. The opportunity to boost profits through innovation in the supply chain are estimated to be about 6% in the retail space and 20% in the hospital and medical device manufacturer settings. Some of the challenges faced in this supply chain are lack of trust and partnerships, conflicting goals across supply chain activities, lack of automation, and high variation in client preferences and demand. So this is where Synthium Health comes in, and you can read here. I'm not going to read these all to you, but this is what they're doing. Synthium Health is providing all of this. It's providing real return on investment, just-in-time delivery, and brand growth and expansion. So it is a definite force to be reckoned with in the healthcare marketplace. It's going to solve a lot of the problems and a lot of the heartaches that some of these providers have talked about as a major concern of theirs. Okay, Synthium Health, what Synthium does is provide a platform to directly connect the buyers and sellers of medical devices, and has had a live and functional system operating since summer of 2015. What they are currently working on, and the impetus for the ICO, is the integration of blockchain as an enabling platform for supply chain management and transparency, contract management, delivery management, order management, and payment processing. Their existing partners are very interested in the new platform and are committed to evaluating it when available. The introductory video gives a nice summary, and it has a link to it here. It's a background shot of the video. Synthium Health SHP token is initially used as a membership fee into the platform, and it can also be used as currency within the platform for transactions where both parties accept it. Tokens can be acquired through the ICO initially, later their platform, or from other users of the platform. And then there's 3 types of memberships: buyers, which is hospitals, physician groups, surgery centers, etc. Sellers, which is going to be the manufacturers, suppliers, and distributors. And then the public, a personal consumer. Okay, so you guys can read the rest of the of this article. It's not very long, but it does go through some information that's important. But the main reason of the video is, one, to just remind you that the ICO is going to end here in 10 days on the 28th of February. But also I wanted to go over some of the information that came out of the conversation with the SEO or the CEO Vinjay, and here's the link if you wanted to check out the actual token sale and register for the token sale. Okay, I was asking him what's going on and what's some updates that he wanted to share. So he knew I was going to do this video, so I wanted to share what he had told me. We are getting started with customer onboarding process of our clients. We plan to start with suppliers and then providers. We're interviewing a few people for that right now. Number 2, white label. We are discussing with a few overseas medical device manufacturers on private label their products that are already FDA approved. We plan to offer certain products to our clients at 20% below what they are currently paying. I mean, come on, 20% below. That's crazy, right? Number 3, after the token sale ends, SHP is already going to be listed on exchange of localbitcoincash.org, and I've talked to them many times before. I know they're trying for so many other exchanges as well, so this is just the first one that they had agreed upon, but I expect many more very soon. Okay, number 4, we are also planning to launch a crypto exchange only for healthcare and related industry tokens. This will take about 3 months to implement. This one here, I mean, it's number 4 here like it's nothing. This is huge. This is huge. A crypto exchange only for healthcare and related industry tokens. You know how big this is going to be? Definitely, you know, it's just poked here in the middle of this list, but this is a big one right here. Okay, and then other tasks that are in the process. They're establishing a presence in California because this company right now is East Coast based. Integration with SHP tokens into the platform itself. Contract management. They're implementing a new sales team, or growing the sales team I should say, pushing the acceptance of SHP tokens within their system and exterior, and of course more. Okay, some of these are going to take up 6+ months to complete. Some of the tasks above, of course, because these are pretty broad range of things that are happening in the system, so it's not going to be like tomorrow or anything like that. But I highly suggest, if you are on the fence about this, get in on this while you still can get in and get the bonus, 25% bonus, and it's only for, I don't know if they're going to end that early, but the end of the ICO is on February 28th. So if you're on the fence, you've been watching this, you're watching the videos, and you're thinking about it, everything I'm seeing here is looking really positive. Obviously I can't give you financial advice, I'm not a financial advisor, but you guys can read this for yourself, make your own decisions, you know, reuse what I have told you here, use the other background information that you've had. These guys, of my last video I showed, were reviewed by a few different outside vendors, you know, and they got very high reviews from everyone that looked at them that I had found. So I think it's a real solid platform. It's not an idea. This company is already established. The system is already built and functioning. They're just adding the blockchain into it. So I have high hopes for this one. Like I said, I talked with the CEO many times. A very awesome guy, very down to earth, and a total believer in his product. It's not one of these companies that are bringing an ICO just because it's the cool thing to do and they're trying to make some extra money. I mean, this guy really believes in this system and his idea and his company, and he's definitely going to do whatever possible to make this thing work. So I believe in him. I put some information into this, and that's the reason I bring it over to you guys. So take a look at it, and like I said, 10 more days, February 28th it ends. The bonus right now is 25% extra when you buy this. So check it out, and if it's for you, go ahead. And if you have any questions, of course, email me, donkeat, DONKEAT, @gmail.com. I'll try to answer anything that you have, and if it's something I can't answer, like I said, I do have direct contact with this company. So if I don't know the answer, I will definitely 100% get you in touch with someone that can answer your question. If you're looking at partnerships or anything like that that you can't deal with, hit me up. I can put you in contact with the right people and get this done for you. So I hope you guys appreciate the videos that I do. If you wouldn't mind, subscribe to the channel, help me out, helps out other people find this information. And if you hit the notification bell next to it, you'll get notified of new videos. We do a lot of updates on existing platforms such as this, and we do a lot of new reviews on ICOs as they come out, mining, automatic trading bots and this kind of thing. So anything crypto related, you may be interested in this channel, and I'll try to keep you guys updated as best I can. I'll talk to you guys soon. Thanks.